you want to kind of give us a little update about what was discussed in previous meetings about the community health fair? What was some of the thoughts about that?
Yeah, we really wanted to, I believe it was there was a space that Heather had that folks wanted us to be able to use. And it was really focusing on like different aspects of health because we wanted to kind of make it more of like an intergenerational event as well. And I just got an update. Let me see in this email because somebody had just emailed me. I think it was you, Mark, about a wellness.
Diane.
It was Diane.
Yeah, it was Diane.
Oh yeah. So the date is going to be in March, and Senator Adobo is going to be one of the ones that sponsors it as well. That's how we're also tying in like the Narcan information and training. There's going to be like a little section in the back where people can kind of come one on one and talk to folks about Narcan or how they can get trained. Um, and then there was also this medical clinic in Forest Hills that Diane is working with that was wanted to sponsor it as well. We also wanted to have all of the elected officials sponsor it. So we have spoken with Lynn about it and other folks. So it looks like we have the um the date lined up for March. She didn't put exactly what it is in the email. So I will follow up with Heather just to make sure that everything is
Right.
copacetic with the date, and then we'll start also getting more folks into the room to be able to really figure out all the different health kind of aspects that we're going to focus on. So it'll be definitely more of like a fair where there's a bunch of different stations, a bunch of different information, and definitely a lot of community board members and other folks for people to ask questions to as well.
So from what I thought, we were going to be working also with the hospital. Am I getting
Yes.
that right, Kendra? In terms of
Yes.
LIJ, we were supposed to be working with them, right? And wasn't Heather trying to arrange something through the hospital? Am I getting that right?
Yes, and they are down with it as well. It was the location that was snagging folks up. I know it's some community center that Heather said that I think I put in the notes from the last time, maybe in the bottom of the report. That space did get confirmed. So I think that was one of the holdups, but the hospital is supposed to
I'm
be
sorry, what was confirmed?
that space. I believe it was in the bottom of the report. Possibly there was a community space that Heather was working on.
Right, I was right. That was like the Rego Park where we vote, where people vote early. So I thought that we were going to be trying to have this at the hospital. And the hospital was going to be a sponsor
Yeah,
of
the
the
hospital
Narcan
definitely
training.
was going to be a sponsor, but we never thought we were having it at the hospital. I believe Senator Adoba wants us to have it at that spot specifically.
Okay. So what would the committee prefer to do at this point? So it sounds like we have two potential options. So the hospital option, what happened with the hospital is that they were kind of hard to pin down. Heather had been trying to pin them down for months. So they're actually going to be coming to the board on Wednesday to do a little announcement. So if the committee would want the hospital to be involved with this could be an opportunity for either me, Kendra, or Diane to approach a representative at the hospital at the meeting on Wednesday and see if they would want to be a sponsor. And if they would they want to do it in the hospital or would they want to do it in this space in Rego Park? So what are people's thoughts about this?
If we have a confirmed space, that's
I
great.
don't think the space has been confirmed yet.
Oh, it looks like according to those emails, they might have
So
been.
Diane said that they're trying to get a date, and once they get a date, they'll try to confirm the space. But there's been no, to the best of my understanding from reading that email Diane sent, that there hasn't been a space confirmed yet.
Okay, well, I do know that the Rego Park space is always open to letting us use that space, and I think it's also free. However, I do know there's a limit on I think is it 115 people, and like, and I'm listen. I would love to have that many people, but I just want that to be a thought. Is that if we're having, let's say, 50 people being representatives of health organizations, and then we have another 50 to 70 people, that it's going to be hard if we have a line out the door, especially if it's March. It's going to be a little cold. That area is a little shaded. Um, so if we can get a bigger space, great. That's I'm just throwing that out there. I'm not trying to put pressure on anyone to find a bigger space. I just want to throw that out there because I have been in that space, and it's not small, but it is not big either. So,
Right. So again, I thought this was predominantly going to be a Narcan training. It wasn't going to be, and again, I missed the meeting, so Kendra, I'm sorry, I'm going to have to ask again. Was the intent here to make this a health fair and Narcan training, or is it just to have the Narcan training and then do a health fair separate from this?
No, the Narcan training would be provided at the health fair, and again, it was more so because a lot of the folks we felt that were probably going to want the Narcan training wouldn't want to do it in such a public forum. So we were trying to keep that like more of a private space in the back where people could really have like one-on-one conversations and kind of get more in-depth health, because usually it's like a family member that's struggling with substance use.
All right. So again, the plan was to separate the two, right? To have the Narcan training in one place and the health fair in another. Am I getting that right?
I mean, the it would be the Narcan training would be at the health fair, but it would be in the back,
Oh, okay.
private, kind of even one-on-one. Narcan training is pretty simple. So the hospital was going to provide staff that would be able to do it one-on-one at the health fair. What had happened was Senator Adoba was planning on doing a health fair anyway. So he wanted us to kind of partner with him on this. So that's how it kind of got to be something a little bit bigger than just the Narcan
I
training.
see.
Yeah,
Okay.
because the senator was already kind of planning to do this anyway.
I see. Also, I had sent around an email that historically Heidi over at the 112th Police Precinct, in conjunction with the Lions Club and the Regal Park space there, in the past they've done health fairs. But I don't know if it's as broad as what we're trying to discuss here. So perhaps since we're already including Senator Adabo in this, maybe we should also kind of touch base with Heidi. Because Heidi, the last time she did this in April of 2023. So it's kind of close to we're planning it for March. So that's another possibility. So how does that sound? That we try to see that we can have Senator Adabo, we can have the 112th Police Precinct Council, we have the CB. The challenge here is, as Brantley's saying, space is limited in that site. And unfortunately, we don't have much space. I mean, this is what we came up against for the community board. One of the reasons that we meet in the borough hall is there really isn't that many available spaces here in the community that are fairly large. And I can tell you, because I've worked with the hospital doesn't have that many large spaces, ironically enough. You would think a hospital would, but they don't. So I'm just saying, I think the only other possibility is Common Point. Common Point does have space. I know I've done programs
their
there.
space is a lot less than that room in Rego Park. So their space
Okay,
only holds up to 50 people.
okay. So it sounds like we're gonna have to try to make the best of the space in Regal Park. So maybe not having as many exhibitors to give us more space. What do people think of that?
I don't see anything wrong with having less exhibitors. Um, I just think we need to confirm the amount of people. And if we're having a training, which I think is great, as part of the committee, I mean, as part of the health fair, I also, Mark, your point of even potentially waiting and pushing it and combining it with Heather's. I don't know if that's how they're changing.
With Heidi. With Heidi.
Excuse
That's
me,
the
Heidi.
112th Police Precinct Council.
Yeah, the 112th precinct. That would give us an extra month to plan everything. But you
Well,
know.
Heidi did it last year, but Heidi's not planning on it this year, Mark, right? Or yes?
I don't know. I don't know what Heidi's planning.
Well, what was this email that you forwarded to us, Mark? It looks like they're doing something.
Oh, so she did one in April 2013. I'm sorry, April 223. I forwarded that email to you just to show you
Okay.
that she did one April 223.
Got it.
So she's got a track record of doing this, and I think she did one even before. I think she did one prior to COVID as well. So I know she's done this a few times. And honestly, it was Christine who was the one who reminded us about this. So it's, again, I'm just broaching it with the committee because we don't want to step on Heidi's toes. So I'm not sure if she's doing it again or she's planning to do it again. I do know she works closely with Senator Addabbo as well. So if he was planning something, maybe he was planning something in conjunction with Heidi.
I think on Wednesday I will definitely figure out because we'll all be in person together. So I think on Wednesday we can kind of like nail down the rest of these details to make sure that we're all on the same page.
Okay. So just to kind of wrap up about the health fair. So do we want to still try to shoot for March? Yes.
Well, yeah, I think that's the senator's going to do this anyway without us.
Okay.
So
He's going to do it in March.
Yeah,
So
he had planned on doing this in March anyway. And then
So
with
he's-
Lynn's new diabetes bill, we thought that she would be excited to be a part of
okay,
it as
so we're going to partner with Senator Addabbo and Lynn.
well. Yeah, because we, with her diabetes bill, she wanted to be included on anything that we did around health.
Okay, so Senator Addabbo, Lynn, Councilmember Schulman, we'll use the Regal Park space, and we'll also reach out to the hospital. So Kendra, you, I, or Diane maybe can try to buttonhole them on Wednesday
Yes.
and tell them what we're planning to do. And I think they would want to participate, and they would actually do the Narcan training, right?
Yes, that is the goal. And they have agreed that that's the piece of it that they want to do. So we were thinking about putting like a curtain up where people could kind of like go behind. And like I said, it would be really private for them to kind of get like more of a one-on-one Narcan training. It's only like 10 minutes, 15 minutes. It's not
So,
like it's
again, in terms of setup, maybe we'll have like a divider or something because that's a big space. So we'd have to bring some type of private divider, and then people could go and get you're right, the Narcan training takes 5-10 minutes. And then get the Narcan training separate and then have the exhibitors as well.
Exactly.
Does that sound okay for everybody?
I think this sounds like a great idea, and I particularly like that we're kind of like tacking it onto another event, in partnership with other like elected officials and stuff, because we're trying to reduce the stigma around Narcan, and so what better way to do that than to just make it part of
the health fair.
Yeah,
that makes a lot of sense.
Existing thing, yeah.
Yeah, that makes a lot of sense. All right, so Addabbo, Schulman.
Kendra,
Can I just ask something real quick? Sorry, Bentley, if you don't mind.
Serena.
I'm
Serena.
curious to know. Thanks. I'm curious to know, as a committee, what would be our role in this? Like, would we come to the event? And if you already said this, forgive me, but what would be our role in this event?
So our role will be, well, for starters, our role would be to set this thing up. That's one thing. And then in the actual event, we need people to kind of run it, right? We need people to be greeters. We need people to steer people. Here are the different things, hand out flyers, that type of thing. So hopefully the committee would play that role.
Got it.
Bentley, I saw you raised your hand.
Great.
No, I apologize. That's how it up. But Serena kind of asked the same question I did, and But I also want to just add additional is what do you need from us leading up to the event too? Because I work in a mental health nonprofit organization, so we could have people come. I can have someone come, and we have a military services program. We have adult services. We have child services. So we could bring like a table. I can see if somebody can come and do a table. I can help out by asking elected officials. I'm really close with a couple of the elected officials due to my role and my position at the nonprofit. So I guess that's another question that's going in addition to Serena's. So
Okay, so I guess you're asking the role of your not-for-profit.
no, I'm asking what do you need from us as a committee leading up to the event, not just the day of. So do we need to, besides sharing out the flyer on our social media, I'm assuming that's something you'll need from us. You may need us to reach out to elected officials if we have a connection with them, I'm assuming. Do you need us to reach out to other companies that
Yeah,
are in substance
think it
abuse,
would be-
mental health services, things like that?
All right, so you're not asking to have a table there. You're asking if it would be okay for you through your organization to educate people about this event. Is that what you're asking?
It's a general, not just my organization. My organization can be there if you would like them to have a table. I can ask them if they would like to.
Yeah.
My thing is, what work do you need from us as a committee member? Because
Right. Again, I think what we just for you as committee members, just to, I'm going to ask because obviously there's going to be a number of moving parts here.
yes,
So we should get, I'm going to ask as committee members, for starters, I mean, we need somebody, I know Diana's reached out to Senator Addabbo. Kendra, I think you have a relationship with Councilmember Schulman,
Yes.
right?
Yes.
So you'll reach out and you'll confirm with Councilmember Schulman. That's the
Yep.
second component. I guess one of us will reach out to the hospital on Wednesday, me, Kendra, or Diane.
Yeah, and it would be great if we could get, I think we had in my last notes, we had talked about Common Ground, and there was one other one that at least works kind of in our community. Some of them touch on mental health, but if Brentley, if you have an org that's like really in depth in it, and I love how you hit on veterans and children, I think those are two areas that, you know, lots of folks would probably want to at least have information on. So I think we could be really strategic about that, but I would love to have a really strong, nonprofit mental health org in the room. Brentley, I
Yeah.
think that would be a great idea.
yeah, no, definitely. And I can definitely talk to them. We're based in Forest Hills, but we help the entirety of Queens. So I think I can definitely see about someone doing a table.
Right. Just as long as the issue here is you're not for profit, right? It's different because we've had over the years for-profit providers wanting to participate, and that gets tricky because of the community board. We can't really support for profits, but not for profits isn't usually a problem. So it would be great for you to bring in your not for profit, and that could be a table.
Sure.
Any other tables or any other groups that we can think about that would want to participate that we should reach out to in a health fair? Or maybe that's something we can think about and maybe kind of put it out there. Because again, so Brantley, you seem to have, I know the room, but I think you have a better sense of it than I do. How many tables do you think we can fit in there and it won't get too crowded?
The last time I was there, there's still a lot of room, and there was about 30, I'd say like 20 tables. And I think it just depends on how you do it. If you set them out on the outer wall, you can leave a spot for the Narcan training in the back, and the bathrooms are also in the back as well. And there's like a small kitchen area that has like a sink. So it just has to be strategically done. But I know that they've done it because they've obviously had it for early voting, and that's
Right.
a lot of people.
Right.
So
maybe what, 20 tables?
I'd say if we can even make it less, we have more room for Narcan if we need to.
Okay.
We can do 15.
Maybe do 15 tables. So right now, what we have so far is we have Senator Addabbo. So Kendra, Senator Addabbo is going to be doing, did his office volunteer to recruit potential tables, or is he leaving that up to us, or is it going to be a combination of us and him?
I believe it's a combination of us and him. I got to confirm that with Diana though. She's really
Okay.
in touch with him.
Okay, so maybe what we can do is let's hold off. I think Brantley, you're a member of the committee. It sounds like your organization will be a perfect fit. 100% we should officially invite Brantley's organization.
Mhm.
Other than that, I think we have to get in touch with the senator, see who else he had in mind. And then depending upon who he had in mind, which we should try to limit it to maybe no more than another 10 or 15 tables tops. How does
Yeah.
that sound? Does that sound okay?
I'm good with that.
Yeah, I'm good with that as well.
Okay, good. So in terms of what the committee, so going back to the question of what the committee could do. So Brantley, your assignment is to confirm with your group that you're available and give us some. So we're going to do this. So Kendra, was the discussion doing this on what? Was it an evening? Was it going to be a day? Was it going to be a weekend? Was there any discussion about that?
I believe it was going to be an evening. For some reason, I want to say the 24th, but let me, like I said, on Wednesday, we should have the date for sure, and I can resend an email out to confirm with folks.
Okay. So it would be like an evening. So it would be like what, 6 to 9, something like that?
Yeah, I think starting a little bit earlier so that way.
Even
Maybe,
earlier. Okay.
yeah, a little
So
bit
saying,
earlier and then going till 8 or 9. So that way folks that are coming out from work can also do it. But people that, have availability during the day could do it. I believe it was like 4 we were thinking. But Wednesday we should definitely have the location and the time, because that's what we need for the flyer to start to be able to actually like recruit.
right. So we're saying 4 to 9. 4 to 9 or 5 to 9.
Somewhere around there was the thought of it.
Okay.
Yeah. So like I said,
Right.
Wednesday we could have confirmed the exact date and time.
And Senator Adabo will be booking the Regal Park space, right? That's not gonna have to be on us.
It's I can reconfirm with Heather, but I believe it's not supposed to be on us. Yes, that was Senator Adobo was having
That
that.
was Senator Adabo. Okay.
Yeah.
Okay. So in terms of what the rest of the committee can do at this point around this, I think we're pretty set. Just to sum up, Diana's been in contact with Senator Adabo. Kendra's been in contact with Councilmember Schulman. We're going to try to speak to LIJ Wednesday. Brantley's going to invite his organization to come down. And then we're going to try to it's going to be sometime in March. It's going to be an evening, 4 to 9, 5 to 9, something like that. And we're going to confirm with Senator Adabo that his office is going to be booking the Regal Park space. And then we're also going to confirm with Senator Adabo which organization he had in mind to invite, and we'll supplement that, or depending upon how many he had in mind. I think that's pretty much everything at this point. And for the other committee members, again, just to be there whatever night, and just so we can serve as hosts and hostesses, just to welcome people and steer them, give them kind of overview. And we're planning this for March. So okay, so we'll get into, well, maybe now. So given we're planning this for March, I know the committee has been meeting every couple months, but given there seems to be a lot of moving parts here, do we want to try to have another meeting in February? So by then we'll hopefully have all the moving pieces together and we can finalize stuff and then finalize the flyer, and then we can move forward. How does that sound? Would people be okay meeting again in February?
Yes, that sounds great to me.
Yeah.
Yes.
Yes.
Yeah.
Okay.
And just confirming that this would be open to the public, right?
100%.
Yeah.
100%. It's open to the
confirming.
public. We're the
Great,
community
yeah.
board. We're city
And there's
agency.
no age group on this,
We
right?
can't close it to the public. It has to be open.
Yeah,
There's
no
no
age.
age
All right.
group.
No age.
All right. So we agreed the next meeting is going to be February to kind of pull this all together. And Kendra, don't worry, I'm taking notes. So I'll send the notes out. You don't have to worry about that tonight. Okay.
Thank you.
You're welcome. All right. So the next item on the agenda was, okay, so Kendra, can you go a little bit into what this DV series was? What was the concepts behind that?
Yeah, and first, before we do that, for those that aren't aware, we are this subcommittee is a co-sponsor on the Let's Talk with Seniors and Teens, and it's around healthcare, but it's like a intergenerational conversation.
Oh, that's
Bruce,
happening. That's happening in a week
yeah,
from tomorrow.
Tuesday. Yep, Tuesday, January 16th at 7 p.m.
Right.
And so I just wanted to let folks know Common Point Queens, that was one of the organizations, Mark, that we had also had on our list for the health fair.
Yeah,
Because I know they do a
I would
lot
think
of
Common
work
Point.
there.
And again, if you're gonna have Common Point, you gotta have Queens Community House. You can't have Common Point without Queens Community House.
Yeah. So Bruce had sent out an email, and I just wanted to make sure folks got it. If they need it, I can resend. But we just wanted to spread the word about that, and that is something that our subcommittee is co-sponsoring. So it was great to have a lot of the subcommittees working together on that. So I just wanted to give folks a shout out for that. Now the DV series, what we were trying to do was really get like through this month of January for the health fair, and then in February start talking about it. We wanted to do possibly like a webinar series around domestic violence, having each webinar focus on a specific group. So there's, a lot of folks that want information about elder abuse, for example. We have a lot of seniors in our communities. And so we wanted to do a series on, how to keep our seniors safe, right? Or some stuff around elder abuse and signs that, maybe that elder is being abused by a family member, and what ways in which we as people who are just like community members or people that, might be working with them in a different capacity can kind of act on that. Young people was another huge area we wanted to, and what we wanted to do was have the other subcommittees co-sponsor, right? So it'll be coordinated. So when we talk about our young people with domestic violence and dating, I do a bunch of stuff on that with my young people. We wanted to make sure that the youth subcommittee co-sponsored. So it's more of a planning process to figure out which one we want to start first and how we can co-sponsor. I was thinking about the elder abuse, starting that one first, just because we've been doing so much around the seniors with all these other events coming up, that it might tie in nice. But it's definitely a larger project, and we wanted to be able to kind of have the whole series planned out and then be able to launch in June, but having the series kind of planned out. So that might be 3 different webinars, it might be 5. I think it'll depend on the, amount of people that show up, or the kind of, just amount of information that we need to share with the specific groups. So that's kind of the goal around that. I think everyone on the subcommittee can play a role in that as we continue to progress. And I think that's more of like a long-term kind of overall project for this subcommittee.
Right. So because I was the one who started Kendra mentioned this intergenerational program. So I was the one who kind of started that series. So I could share with the committee members how we launched that. And maybe I could serve as like a model for how you want to launch this. So what we did with the intergenerational is we actually got a partner at CB9. It's kind of not as strong as it used to be, but we actually met somebody from CB9, and she was willing to represent CB9 on the intergenerational committee. We then also recruited Queens Community House and Common Point Queens. They were kind of sponsors of this as well. And we recently started working with another civic group called Let's Talk Democracy. They're like a civic engagement group. So they're part of the planning and the organizing of this intergenerational series. So that was kind of like the model that we used for the intergenerational series. I don't know if that would be something this committee might want to duplicate. Maybe, instead of having the whole committee plan this, we invite representatives from these different organizations. That's what we ended up doing with the intergenerational. So and just like this is a small committee, Aging, Social Service, and Disability is also a small committee, but we kind of leveraged the ideas behind it, and that's why we partnered and we recruited representatives of each one of these organizations, and then it kind of grew because a number of people we recruited to be panelists then stuck around. So I've had meetings with the intergenerational that have had 10, 15 people coming. So I'm just sharing the model that we use. I don't know if that's a model we can adjust for this concept that Kendra was tossing out. What do people think of that?
Yeah, before others jump in, I'll just say, Mark, I really like that idea, and that was the goal for this. Also, was to have different folks come in that were experts on specific sections, like dating, violence. Obviously, we would have that, or young people. We would have a specific org that really works with that. So yes, our thoughts were kind of on that same stream, but I would love to hear others' feedback as well.
All right. So how about this? How about in terms of planning this, I think instead of keeping it with this committee, if people want to reach out, I mean, I can reach out to the contacts. I have a Common Point. We're working one person at Common Point. I can see if she can, now Queens Community House, they're going through some changes. So the contacts that I had have gotten kind of busy. I could try. Does anybody have any contacts with Queens Community House? No. Okay. I can try to use my contacts at Queens Community House. In terms of other committees that would be kind of like within CB6, you want to see if I know there's a youth committee. You think it would be appropriate to see if CB6's youth committee would be interested in being the co-sponsor to this?
Oh yeah, absolutely. I think especially for the one around teen dating and young,
That's what I'm
you know,
thinking.
violence around young people.
Right. And so maybe we can ask them to join. And then kind of my suggestion would be to kind of peel this off from the committee. But the committee, I would suggest the committee first start working on trying to develop partnerships and then have meetings about this separate from this committee. And what we did with Aging, Social Service, Disability is we would report back, periodically in terms of, but the actual work of organizing the series was done by this separate coalition, kind of. Does that sound like a model you want to repeat here?
I think that sounds like a great idea. What do others think?
For that.
Yeah, I do too. I just have a question, Mark. When you were doing all this stuff, did you also reach out to like because I used to work at the NYC Department of Veteran Services. So we used to have like certain committees and certain things we used to work on together, like in terms of the Department of the Aging and stuff like that. Do you have any contacts maybe over there? And do you know if they would do something like this for us? And then the Department of Youth and Community.
Danny, if you've got contacts there,
Okay.
wonderful. You can always ask. And again, that's why it's good for this committee. What I see the committee being involved in this point is getting off the ground. But right now we have 5, 6 people here, and it's a pretty big undertaking. So I'm suggesting if we could partner and have each partner send 1 or 2 representatives, optimally. I mean, fact is right before this meeting, we had an intergenerational, we had to finalize the planning. So we had an intergenerational meeting. And again, we had representatives of CB6. I had a couple high school students who were working with us. And again, that's what I could do. I have a relationship with some high school students at Forest Hills High School. Maybe Kendra and the rest of the committee, maybe this is something I could see if they'd be interested in getting involved with this, though I've got them involved in a lot of other things. So I don't know if they have the time, but that could be another possibility. But then, yeah, if you have contacts there, again, just let them know the concept. And if they want to join us, then they can join us and they can participate in the planning of this series. So in terms of So it sounds like the committee's agreeing that we're going to try to put together some type of coalition to plan this series of, this series on domestic violence. So far, I'll reach out to Common Point, and I'll reach out to Queens Community House. Anybody, well, I'm going to speak to Shari tomorrow. So when I speak to Shari, I can ask if the youth committee, Shari Rolnick is the chair of the youth committee. And by the way, what's good about this, it doesn't have to be the whole committee. If anybody has a strong interest in participating in organizing this, you could represent this committee in this coalition. Is there anybody who has a strong interest and would want to represent this committee in this larger coalition? Or you want to think about it?
I mean, I'm definitely happy to. The DV is something that I work really closely with, especially with young people. So I do have a lot of connections with the DV, and DYCD is on my list to reach out to them when we do the young person webinar.
I'm sorry, which organization, Kendra?
DYCD, Division of Youth and Children Services.
Okay. So you're going to reach out to these
DYCD.
DYCE is going to be Kendra, and I'm sorry, and Danny, which was the organization you were going to reach out to?
Department of Aging, and then also
You have a contact with DIFTA. Okay, great.
and Department of Youth and Community,
And
NYC.
Department of Youth, great.
Yeah.
And again, we're a city agency, so these are all sister city agencies. It makes sense. But again, when you reach out to them, we would want them to participate in the planning of this. We're not asking them to do it, but help us plan it. And then, of course, if they have experts or, other members of the committee have experts as we plan this thing, and it's going to be a webinar. It's not going to be in person, correct, Kendra?
Yeah, we wanted it to be a webinar because there's going to be folks that are not ready to talk about being in domestic violence yet, like in a forum, in a public setting, but that might be able to watch it right at home, or it just, we felt that it might be more comfortable for folks if we did it as a webinar versus in person. And that way, when people are ready, they could watch it, as opposed to, that's the only day that they could learn about it, as being in person.
Right. Okay. So, and one of the things that we did too with the intergenerational, which you'll see next Tuesday, is one of our partners, Common Point, live streams the intergenerational presentation through their Facebook page. And then what we do is once they live stream it, then we put it on our, on our social media channels. So what's great about that is even if we don't get like a large turnout, we put it up and it's watched. And I can tell you, intergenerational, I think the very first one we did, we ended up with 1,500 views, which is pretty good given I think we had maybe 40 people who actually watched it the first time. So doing this and then live streaming it would be great, because then it lives and we can publicize it and send it around.
Exactly.
So we'd have to see if one of the partners would be willing to live stream it, or if we can do it. That'll be something that CB6 we'd have to see if we can live stream it. We'd have to try to get somebody who has the tech knowledge to do that. All right, so it sounds like for this project, the next step is, again, I'll reach out to Common Point, Queens Community House, and the youth committee for CB6. Kendra, you're going to reach out to DYCE. Danny, you're going to reach out to DIFTA and Department of Veterans, right? To see if they want to partner. And again, we have the idea. The concept is, as Kendra was saying, a series on domestic violence. We want to bring in experts in different areas of it to kind of educate the community about domestic violence, what could be done, what are the options and stuff like that. Do we want to partner maybe with the 112th Police Precinct Council? If you're talking domestic violence, it'd be good to get the NYPD involved, or you don't want to get the NYPD involved. What are people's thoughts about that?
I think having them co-sponsor, I think, would be great on a lot of these. And then I think we could take a little bit more time to think through, if we wanted to include them on a specific webinar, what would that look like? I know that, NYPD has their specific DV squads. I'm not for sure what the 112th precinct looks like with that. But I think if we found out some more information about that, we met the officers. Like I'm always, you know, with domestic violence, bringing in the police is always usually an issue for the person that's being harmed, right? Because then it takes away the person who often sometimes is the breadwinner in the house, right? If the police do take them away, or if they get released right away, then it really doesn't solve anything and it just puts the people in more danger sometimes. So I think we can think through. I would love for them definitely to at least code like sponsor all of these, right? Because I think that would look good for them as well to be doing this, but maybe not them not necessarily having a speaking role or anything like that. But we could think through what a specific webinar would look like that NYPD could play a
Okay.
role in. But I think
And also the
I would want
DA,
to have more conversations with.
also the DA, district
Yes,
attorney. I mean.
yes, good old Melinda
So I
Katz.
kind of like said the NYPD and the DA together
Yes, yes,
because they
yes,
do
and
work closely on domestic violence issues.
and we could really, I think if we brought the DA in, we could really talk about the diversion and resources that families need in order to successfully, you know, move forward from domestic violence. And really focus on that and kind of educate folks. Because I think one thing, you know, we always hear is when domestic violence occurs, it's call NYPD and get them out of there. That's not ever usually the end, like the end result of what happens though. It's not that simple or easy, especially when you talk about relationships and marriages and children that are involved. Um, so I would love to focus more on the diversion and the resources that folks need and how we can keep families together, but make them healthier and stronger, help them become healthier and stronger. So their immediate resort is not to be violent, right? And not to create harm to the person that they love.
Right. So I was just listening, and what I was thinking is maybe one of the webinars could invite the DA and the NYPD to present on what, maybe not the first one, but
Right.
maybe a part of the series we can invite the NYPD and the DA to present on, what the protocols and procedures are if you are a victim of domestic violence.
Right.
How do they go about, what type of services they have available, you know.
And
Maybe
you know,
that could be a webinar.
yeah, and we did just get a really important. So I don't know if folks know the end of the year. I got 3 of my legislative bills passed that I've been working on for years. One of them was ending halts. It was the halt solitary confinement. So it's ending solitary confinement. We know solitary confinement is torture. We know there's better ways to
That's
work
the
with
city
folks who are
council.
suffering. Right, and there was some other ones. One of them was around NYPD. So, and I've actually seen this happen when we are a victim of a crime. If we don't, and this is in certain neighborhoods, but I've literally like witnessed this firsthand and helped a family through it. If we don't talk about who the perpetrator is, right? Like if it was a shooting and the person doesn't want to, for a better lack of word, snitch on who the shooter was because there's all these other issues. NYPD was not, you were not allowed to get money from the Victim Services Fund, right? And so this has happened even to women who have been in domestic violence. If they're not willing to report it, then they don't receive any services. So I'd even be interested to see now that this law has changed and you do not have to report who that specific person is in order for you to receive funding and services through this victim support fund and center. I'd be interested to see like if that's going to change what the DAs and NYPD do or just what their thoughts are around that, because I think that's a huge win for people who are in domestic violence situations, but scared to report necessarily exactly who the victim was, but that it did happen to them so they could at least still get the services. So just wanted to throw that out there because it's very interesting. A huge win for a lot of folks that people don't realize was an issue. And I think a lot of people don't understand. You know, I had a really good friend that got shot and it had to do with drugs and involved in that. But just because he would not cooperate with the police on who the shooter was, I mean, he basically like lost his leg because of the way that he got shot. And to see that process of him, and of course they were non-English speakers, and I was working with a mother, and to see how they were treated, and how they didn't receive any of those services, and how basically like his leg is not useful at all, right? And if he would have reported, he would have got the money to be able to actually do the surgery the proper way so he could utilize his leg, where now he'll never really be able to walk. So I've seen that happen, and it's just really sad to know that there was always that barrier, and that I'm happy that we got one of those bills passed. So I'm sorry I went on a tangent there.
No, you didn't go off on a tangent, because I think that's very appropriate. If this committee and this coalition sponsors this, among one of the things we do as the sponsors, we come up with the questions. So if that's one of the webinars that we ultimately end up planning, Kendra, you could definitely ask the question, this new law passed back in January of 2024. How has it been implemented? Because probably by the time we get to it, it's going to probably be, maybe give it like 6 months or something. So you could then begin to see how the law changed things. That could be one of the questions we can ask. All right. So to sum up, what we're doing for this is we're going to try to put together a coalition, and then we'll have the coalition. So again, I'm going to ask Kendra, do you think you want to be involved? Obviously, it sounds like you want to be involved in this, right?
Yes.
All right. So maybe you'd be the representative of this committee. If anybody else wants to be part of that, that's fine. And Kendra, I don't want to again put you on the spot, and I'm sorry for your loss again. Would you be willing to kind of lead this coalition once we kind of pull it together?
Yes, no, absolutely. Absolutely. And thank
Okay.
you all for your condolences.
Okay, good. So you can, Kendra will lead it. And then Kendra, I'll let you know if my success in reaching out to my contacts, and Danny, you could let her know about what your success is reaching out to your contacts. And again, if anybody has any other thoughts of who we could reach out to on this topic that we're forgetting. So, all right, so we're not going to reach out to the 112. Do you want to reach out to the 112 Police Precinct Council or no?
I think, yeah, like at least to sponsor we can. So
Okay.
let me have a conversation with them on Wednesday, or with folks
Speak
that
to
really work
Heidi.
closely with
Speak
them.
to Heidi.